medications may be necessary, as well as vitamin and mineral supplements. Talk to your doctor about what you should take.
Should I be eating differently now?
Well, over your pregnancy, your nutritional needs are going to increase gradually. Now, you're pretty typical, so during your second and third trimester, you'll need to increase your intake of calories by about 300 a day.
Your daily routine doesn't have to change much during pregnancy, especially if you're in good health and get enough rest. Eating well is your best start. Well-nourished babies come from well-nourished mothers. Eat balanced meals with foods from each of the food groups. 3 to 6 servings a day of fruits. 3 to 5 vegetable servings. 6 to 11 servings of whole grain or enriched bread, cereal, rice, or pasta. 3 to 5 milk and milk products. 2 to 3 servings daily of meat, poultry, fish, eggs, nuts, or beans. Fluids are important too. Try to drink 6 to 8 glasses of water, juice, or milk every day. Avoid high-fat foods and calories with little nutritional value, like sweets, potato chips, and soft drinks.
You can see how the foods you eat and the choices you make in early pregnancy affect your health and your developing fetus. Rest is important too. With so much happening inside you, it's normal to feel tired. Make sure you get enough sleep, including naps when you can. During the second trimester, much of the magic of pregnancy becomes real. Your body begins to show changes. You also start to feel movement inside you. Now it really becomes exciting.
A few weeks into the second trimester, the fetus looks like a tiny human. All that's left is for organs to grow and mature, and for the fetus to gain weight. But look at what's happened already. The fetus actively turns in the uterus at around 16 weeks. By 18 weeks, the fetus is fully formed. You can see a mouth and lips and distinct sex organs. This looks like a girl. Around 20 weeks, you should begin to feel movement. By the end of the second trimester, the fetus is 11 to 13 inches long and weighs 1 to 1.5 pounds. For many expectant mothers, like Jana, the second trimester can be like a honeymoon. The first 13 weeks went smoothly. She was tired a lot and had some morning sickness. Now she feels better, has a stronger appetite, and looks good.
John.
What?
Feel the baby. Quick.
You're kidding?
Yeah.
Where?
It's right here.
There it is. Yeah.
Feeling movement reassures you everything is okay. It's an excitement that you can share. Outward physical changes become more noticeable during the second trimester. The enlarging uterus and changes in your posture can strain your back muscles. Some women also experience pain in the groin or the sides of their lower abdomen. It's caused by stretching of the support ligaments around your uterus. Your doctor and nurse can describe ways to relieve discomfort. Exercise is recommended during pregnancy. It gives you a sense of well-being. It can also reduce backache and tiredness. If you already exercise moderately, you can probably continue. If you're just starting, go slowly. And talk with your doctor first about appropriate activities. It's easy to be preoccupied with preparing for your new arrival. But try not to ignore each other. Remember, it's romance and caring that got you here. If you have questions about intimacy and sex during pregnancy, talk with your doctor or nurse.
During your third trimester, every step you take reminds you that you're pregnant. Now's the time to think ahead to labor and delivery. Childbirth education classes can help you learn about breathing and relaxation techniques, exercises, birthing options, and infant feeding choices. You can share your experiences and concerns with other expectant parents and with professionals. Taking care of yourself is just as important now. Eat healthy foods, exercise, and get enough rest.
Like many expectant parents during the third trimester, Danielle Robinson is really beginning to identify the baby she's carrying as a unique person. She and Curtis hope her baby's slow, gentle movements are hints of a calm personality. Her fetus is more aware of the surroundings now. Voices, stomach gurgling, music, and other sounds. You're more aware of your pregnancy now. Your baby takes up more space, and the uterus begins to crowd other organs. As it expands upward, you may feel short of breath and have a decreased appetite. As the due date nears, your fetus will move down. Then your lower abdomen and back will feel heavier. Since your bladder is more compressed, you may urinate more frequently. You may also experience constipation and abdominal cramps. Many pregnant women are concerned about weight gain. If your weight's normal before pregnancy, you can expect to gain around 30 pounds over the 9 months. Approximately 15 pounds center around the growing fetus and enlarging breasts. Otherwise, the weight gain is distributed pretty evenly through your whole body. During the last 4 to 6 weeks, this extra weight may cause some leg cramps and mild swelling. It's especially noticeable if you spend a lot of time on your feet. To reduce cramps and swelling, elevate your legs when possible, exercise regularly, and wear support hose. It may be harder to sleep during the last few weeks. Between worrying about the baby, increased trips to the bathroom, fetal movement, and getting comfortable, sleep can be a challenge. Try sleeping on your side, preferably your left, and placing a pillow between your legs, or experiment to find a comfortable position.
With an uncomplicated pregnancy, most healthy women can continue to work until delivery. Talk with your doctor to see if your work activity should change with pregnancy.
No diapers.
Pregnancy is full of wonder and drama, all leading up to the birth of your child. Plan ahead by understanding what happens during pregnancy. Know how to take care of yourself. See your doctor and nurse regularly and follow their recommendations. Make the right choices for your health and a healthy baby.